Okay, I'm back. I think our slides are going to be a little better this time. Chapter 13, I figured what I did. I hope you can hear me okay. And now I was going to tell you, chapter 64, we're only going to focus on lupus, as your slide says there. So that starts on page 1538 in your textbook, 1538. And like I said, we're only going to just talk about lupus, and that's going to finish up our lecture for today. We were talking about allergies a lot with my last portion, and it's now recommended that babies start being introduced to like a peanut type food to try to get them not to be allergic, to prevent allergy. So that's kind of interesting because we are finding out, it says the latest CDC results says that we are having more than a huge number of people have food allergy right now. They don't really know why. I don't know if it's all the fast food restaurants. I don't know. But they say that 17 million Europeans now have a food allergy. So they're trying to introduce an allergen to combat that. So I found that kind of interesting for you. Anyway, so we're going to finish up today. Like I said, we're going to go over systemic lupus because, let me go to the next slide here. Because this is a very good classic example of a multi-system inflammatory autoimmune disease of the systemic autoimmune disease process. So with systemic lupus, we know that any organ can be affected. So systemic lupus, it is primarily a disease of young women with a higher incidence in African Americans, Asian Americans, and Native Americans. Your textbook points out that over 250,000 people in the U.S. have lupus. So this slide is, well, you look at it though, 2 to 8 persons per 100. So that would be correct. The female to male ratio is 10 to 1. And unfortunately, it usually attacks women in their childbearing years. The course of the disease varies with individuals, but it's chronic and patients have periods of remission, so they feel good, and they have exacerbations, right? And I need to write me a note real quick. Okay. So how the disease progresses, it's very unpredictable. So let's go into the etiology and the pathophysiology a bit. The etiology is really unknown, okay? Increased incidence is in individuals who have a first-degree relative with lupus, suggesting, again, there's that genetic connection, right? That's why, I felt it was important that I lectured a little bit on genes and genetics. Hormones seem to play a role in lupus. Onset or exacerbation sometimes occurs after the onset of menarche or onset of menstruation with the use of oral contraception and during or after pregnancy. So the disease tends to worsen during the postpartum period. So they usually feel great during pregnancy. And then after the baby's delivered, they have and I'm sure it's a hormonal shift. And then they have a terrible feeling. They have the exacerbations. Environmental factors, sun exposures and burns are environmental triggers. Okay, so we know that. Infectious agents can be a part of it. Acute lupus-like reactions has occurred after taking certain medications like hydralazine. Isn't that interesting? Apresilene, Prenestol, quinidine, and for some reason, a lot of your anti-seizure medications. So a little more on the pathophysiology. What happens is results from an abnormal reaction of the body against its own tissues, cells, and that serum proteins. It is an autoimmune disease. This is an antibody complement reaction. The B and T cells, they're overreacting, okay? There are immune complex deposits in the basement membranes of capillaries in the kidneys, heart, skin, brain, and joints, there is an increase in the inflammatory process and eventually tissue destruction. Type 3 hypersensitivity response, cell mediated. Okay. So some clinical manifestations here. So like I said, it can range from mild to a severe progression. Okay. So as you see there, the most commonly affected tissues are the skin, muscle, the lining of the heart, lungs, nervous system, and kidneys. And you can see we're going to go through the systems here, and as outlined in your textbook, 1538, 1539, and also there's a good figure there, that 64.9 on 1539, which I also have a slide on. Okay. So we also know, and here I showed you, it can affect the skin, the joints, serous membranes, renal system, hematological system, and the neurology system also. And here's our multi-system here, okay? And if I look at your textbook, literally every aspect of our body can be affected. Okay, every aspect of it. So we're going to start out with the dermatology part of it. Okay, so starting with our skin. Starting with dermatologic, lesions can appear anywhere, but usually sun-exposed areas. The butterfly rash is classic. And they do get that butterfly rash. Okay, that is very classic. I made my nose itch. Sorry. Alopecia, which was what? Hair loss, right, as your slide shows there, is also common, but can grow back during remission, but can permanently be gone where lesions have occurred. And here's our butterfly rash. Very typical, okay? Which you can think about right now. Would you want to have that on your face? Probably not, so you can have, think about your nursing diagnosis. Musculoskeletal. So with these folks, arthritis is very common. Your textbook points out arthritis occurs in 95% of patients with lupus. Stiffness and swelling occurs with joint and muscle pain. Deformities may also occur, which we'll see here. You see these deformities of our hands and fingers here, okay? It's classified as the swan neck deformity, which is common, okay? Again, painful. All right, cardiopulmonary, and I think this is, I've taken care of 2 patients with lupus, one during pregnancy and one that had a cardiac issue. Okay, so referring to your slide here, there can be a multitude of cardiac complications. So what do we know about dysrhythmias? Let's think about this. What do we know about dysrhythmias? Well, we know our heart doesn't like dysrhythmias, right? And you're going to be into cardiac soon, and Ms. Henson will talk about dysrhythmias a lot. But we know that our heart does not care for those dysrhythmic rhythms, okay? If tachypnea and a cough occur, then that's an indication of lung disease. But due to cardiac involvement, morbidity is much higher. And I knew someone who didn't know she had lupus until she had to have had cardiac tamponade. Okay, so very serious. And so think about, okay, look, the pleurisy, dysrhythmia. So we know we're not getting good at cardiac output, accelerated coronary artery disease, and pericarditis. Okay, so these folks, their heart takes a hit. Okay. All right. So what's it do to our kidneys? Well, 75% of people with lupus have renal or kidney damage. Damage shows up in about 2 years of diagnosis. So you may have mild proteinuria, or you may have a rapid progressive glomerulonephritis. Okay. Scarring leads to that maturing leads to renal disease. Okay. The goal is to slow the progression of the disease and preserve the kidneys, right? Renal failure is the leading cause of death with patients with lupus. Treatment includes corticosteroids, of course, and of course, they're going to do a lot of immune suppressive agents. I'm just following along down the whole body systems, multi-organ system, right? So neuropsychiatry manifestations are also prevalent with lupus. Generalized focal seizures occur in 15% of these patients. Peripheral neuropathy can occur. So what's peripheral neuropathy? Think about what that is, okay? What deficits can occur with peripheral neuropathy? Well, due to the deposits of the immune complexes within the brain, and cognitive dysfunction can result then, okay? Depression is very common along with mood swings and headaches, okay? Hematologic. So due to the formation of antibodies against blood cells, several blood disorders can occur. So looky there, let's looking at your slide together here. We have anemia, we have leukopenia, thrombocytopenia, good night. So a lot of coagulation disorders too. We can have an excessive bleeding and clotting. All of these things can be occurring, okay? Infection. So unfortunately, these folks are more susceptible to infections. It could be due to deficient production of antibodies and that depressed immune system from the meds that we have to use. Infection is a major cause of death, and pneumonia is the most common infection that occurs. So should they get immunizations? Absolutely. Look, fever should be considered serious. So, yeah, this is posted, and I do like this one. Look at how it affects, of course, I'm a visual learner, but look how it affects our lungs. They're photosensitive, okay? Look at the feelings they have, the problems that can occur here. Our heart, everything, multi-organ functions here, dysfunctions. So what diagnostic studies? So the patient has numerous signs and symptoms of lupus, and that's how diagnosis kind of made, right? Because it's based on the criteria, the history, the physical findings. What are we finding out here? Okay, so there's not one good diagnostic study for lupus. It's a multitude of criteria. And I believe the next slide shows, okay, in your textbook, 6414 figure is diagnostic criteria for systemic lupus. And it says it, you usually have a rash, okay, photosensitive, ulcers, arthritis, pleurisy or pericarditis, a renal disorder. And so there's that whole diagnostic criteria, okay? So then you have your assessment that goes along with it. Sure, you're going to go ahead and do some antibody study, blood tests, complete blood tests, urines, and so forth, chest x-ray to see if there's lung involvement, also an ECG to see if there's a cardiac involvement. So plasmapheresis, folks, is a process by which whole blood is removed from the patient and the plasma is separated from the other blood components. It's kind of like having dialysis. This process is intended to remove the antibodies, antigen-antibody complexes, and complement. It's usually used during acute attack. Once the blood has been separated, packed red blood cells are joined with saline, albumin, fresh frozen plasma, and then it's returned to the patient. Possible complications are hypotension from the removal of that blood volume and citrate toxicity manifested as symptoms of hypocalcemia, headache, paresthesia, or dizziness. What's some drug therapy? I kind of mentioned this already. Well, you think about, you got to have an anti-inflammatory if they have these arthritic symptoms. They're going to have pain. So anti-inflammatory agents such as your NSAIDs. Corticosteroids are given, of course, for serious complications, but steroid-sparing drugs such as methotrexate can be given as an alternative and with maybe a decreased incidence of side effects. Anti-malarial drugs used for managing cutaneous symptoms and musculoskeletal symptoms. Low doses may be given long-term, may cause damage to retina. Ophthalmic exams should be done prior to initiation every 6 to 12 months. We're also seeing that anti-malarial drugs are given right now for symptoms related to COVID-19. I find interesting, quinolone, which they give for malaria. They're saying that patients with COVID-19 feel better in one day. Little side note there. Anyway, okay, what else do we have? Immune suppressive drugs. That would be your cyclophosphamide, Imuran, which may help reduce the need for long-term corticosteroid therapy because we know how hard corticosteroids are on our bodies. Okay. So some nursing and management. First, we're going to look at assessment. For some reason, lupus is sometimes called the great imitator. The great imitator. Why is that? Well, because it can just come, all of it just sneaks up on you, and it has all these different systems that it can affect. So musculoskeletal symptoms, fatigue, dermatology, because the disease is so unpredictable, it is a challenge to determine the symptoms that will bring the patient to seek medical help. Okay, like I mentioned, the person I knew went in to the ER needing a pericardial, she was in pericardial effusion, okay? And she had to have immediate help. She didn't know anything. She didn't know she had lupus at all till then. Subjective assessment, what are you going to want to find out when collecting data on a patient with suspected lupus? What are you going to want to find out? We've got to go through the whole body system, right? Do you have lesions? Have you had hair loss? Are you more fatigued? Are you in pain? Okay. So past history, of course, fever, fatigue, weight loss, right? Family history of autoimmune disease, fatigue and change in energy levels, detailed medication history. Have they been on a Presaline? Have they taken quinidine for some reason, or Prenestol? Are there changes in skin, like I just mentioned? Rashes related to exposure to sunlight, changes in nails, hair. Have you had frequent infections? Is there pain in your joints, chest, abdominal, and peripheral circulation? Okay, we're going to go on diagnosis in just a minute. But again, that objective symptoms would be, do you see a butterfly rash? Are there respiratory issues? Cardiovascular, do they have any friction rubs, arrhythmias? Okay, so some nursing diagnosis. Let's think about it. Given the possible assessment findings, what would be common nursing diagnosis for these patients with lupus? Acute pain, impaired skin integrity, fatigue, ineffective health maintenance related to deficient knowledge regarding medication, diet, and activity, spiritual distress related to chronicity of disease, unknown etiology. Okay, what could think about them, since it's a multi-system involvement. Okay, so here we have, I just went through these, okay? Yeah, and disturbed body image, most definitely. Okay, so there is no set pattern for this disease, and nursing care will need to be designed based on the presenting symptoms, right? Lupus affects all body systems and has psychosocial implications. So general nursing care for clients with lupus, we have that ineffective health maintenance related to deficient knowledge regarding medication, diet, and activity. Client family education, we need to discuss about the disease process. Oh, that's so cute. I'll get to that. Let me go back a second. Sorry. Okay. Chronic disease management, it's important to have the family involved with education. The whole family needs to be involved. Family support is a critical factor to help the patient feel in control. Medications are important. Signs and symptoms of complications, like I mentioned, any fever needs to be considered serious. Edema, decreased urine output, chest pain, and dyspnea. Pregnancy counseling, of course, because pregnancy counseling during remission, because like I said, often these are usually childbearing age when this attacks, and it's usually women, and they want to know, can I have a child? Can I have a child safely? There's an increased incidence of fetal loss by the stress, but the stress of pregnancy will often cause an exacerbation of symptoms. Discussions about pregnancy and birth control should be a topic that the patient will want to have with the nurse, and the progression of the disease and the rate of organ involvement is an important factor for the patient to consider when considering pregnancy. Now, certainly, folks, the gal I took care of that was pregnant, she felt fantastic during pregnancy. It was afterwards that she felt so miserable. So remember, fatigue is difficult because you want to conserve their energy and you need to pace it. Spiritual distress, I mentioned, psychosocial disease progression. Family may or may not have ability to support the patient. These people need support groups, and their disturbed body image is because of the skin rashes. In impaired skin integrity, they're photosensitive and they're very sensitive to the sun, so they need to wear sunscreen at all times. So acute, during exacerbation, patient will become abruptly, dramatically ill, record severity of symptoms, of course. And depending on symptoms, depends on what treatment they will need. So here's acute intervention, again, depending on symptoms. If there's cerebral inflammation, safety is a priority. Client may demonstrate visual disturbances, vertigo, headaches, weakness, and institute, of course, seizure precautions, safety measures, bed alarms, placing the patient in a room close to the nurse station, frequent monitoring, and assessment of neural status. They may have joint pain, accurate assessment and documentation of pain assessment and the range of motion of joints, note edema. Okay. Let's see here. We were going to also, with the cardiac symptoms, assess for changes in rate, rhythm, and heart sounds, murmur, dull, heart sounds, okay? Assess for peripheral edema, assess urine output, monitor fluid intake, alrighty. Of course, keep the skin clean and dry. Peripheral edema, effects of steroid therapy can make the skin very fragile. Move client carefully. Shearing of the skin is a particular risk, right? And of course, you're going to want to plan activities to conserve energy, right? Extreme weakness may bring on a sense of hopelessness. Alrighty. Ambulatory care and home care, important to emphasize involvement for successful home management. These folks take a lot of support, okay? And yeah, as your slide says, they need to adhere to treatment, okay? Minimize exposure to precipitating factors. I kind of went through this already. Lupus and pregnancy. Remember, if pregnancy occurs, women will feel fantastic during the time. Although they may be infertile or have miscarriages or stillbirth from that, immune complexes are deposited in the placenta and inflammation occurs in the placental blood vessels. Much counseling needs to be given, all right? A lot of counseling. Your slide says neonatal lupus may occur in infants born. I've never seen that. The lady I took care of had a great pregnancy. She just felt lousy afterwards. And her child was fine. The psychosocial issues, again, remember depression may have a huge impact. Counseling regarding miscarriage, hereditary concerns, pregnancy. Education needs to be towards about the impact that the lupus has, okay? And you see their physical effects can lead to isolation. Again, they have a body image, a lot of depression with these folks, a lot of why me, why me. So assisting with their goals is very important. We want to make sure that they have satisfactory pain relief, that they comply with therapeutic plan, okay? That they avoid activities that cause disease exacerbation. Because these folks want to just have a normal life. They want to do all the things that everybody else does, right? Maintain optimal function, a positive self-image. Okay, and like I said, expected outcomes here: satisfaction at activity level, pacing the activity, and expressing confidence that they can manage at home. All right, I believe that's your last slide. Yeah. Okay, so I want to mention too, folks, that they're really pushing us to do Zoom. If I may try Zoom next week, but don't worry, I will just create a module and save my Zoom recordings in modules. So you'll just find my recording under module. I'll create a file for that, okay? Also, I will also post after next week, I'll post another little review. I think I put one up already, but I'll put another one up on the immune part and transplantations, okay? I'll be talking to some of you tomorrow under discussion, and we'll see how that goes. Or we may try to do conferencing. Either way, I'll let you know. But this is all for today. I don't believe I have anything else. And thank you, and we'll talk soon. Bye-bye.